हाँ वीडियो चेक करेंगे. Yeah, hi, Rajeshwari. You should. It's 3:18. So should I go in next 2 minutes to get protocol, है ना? And then when I am on my way up, I'll tell you. Then you can get seated. अच्छा, ठीक है मुझे आना है. On the way. So should I? अच्छा, I should get Dr. Paul from the front side. ठीक है, perfect. सर आप एक बार वीडियो को देख लीजिएगा. मैं डॉक्टर पॉल को बुलाने जा रही हूँ. एक बार ही चेक कर लीजिए ना, ये है नहीं होगी वीडियो पे. दोनों ने ज्वाइन कर लिया. रूट क्या हुआ? वो वीडियो रूट क्या हुआ तो नहीं सुने. हेलो जी सर. हाँ सर अभी बस स्टार्ट किया.
I didn't answer. Hi, Gayatri. Can you hear me?
Hi Meenakshi, I can hear you. Hi.
Hi, nice to see you again.
I can't see you. Your video is not on, I think.
Okay, okay.
Yeah, good to see you.
Same here. Nice. Couple of last days we met again. Huh? Nice. Coincidence.
Uh, I'm muting myself because I think there is some disturbance in my mic.
Okay, fine. Fine.
But I can hear you. So I could not join the webinar on the second day because there are too many things on my plate. Yeah.
Anyway, it was good that we are able to relate to that tonight. Thanks for that.
Yeah. So how often do you come to Delhi?
I normally come once every 4 months, but today, no way.
Because of the, yeah,
Travel.
okay.
So are you able to go home? Jaipur after?
I was in Jaipur because for some time, then I came back here. So it's it's easier to manage in Jaipur and all. You have some help, extra help.
Yeah.
Delhi, you have to struggle on your own. Yeah.
But it's not
So what are going to happen to the academic session?
uh,
No news as yet.
okay. We were supposed to exam for today and someone hacked the website. They
Oh,
tried
oh.
data, but then everything was kind of disputed and so we can't know where the things have gone wrong.
So, hello, good afternoon, everybody. This is
Yeah, good
Rakesh,
afternoon.
Dr. Rakesh Sarwal from Niti Aayog. I'm Additional Secretary looking after health and WCD.
Yes, I'm in place of Alok, Mr. Alok Kumar.
Well, not exactly in his place, but his place is still vacant. So, but I am additional secretary here, so I till an advisor joins, I'm handling this vertical directly. So, welcome to all of you.
Thank you.
Dr. Gayatri, Mrs. Gayatri is there.
Yeah.
I see you, Gayatri ji. You are based in Delhi.
Yeah.
You are on mute. Currently, you are on mute.
Yes, I'm on mute because my I think there's a lot of background noise from my mic. So
Okay.
can you am I audible now?
Yeah, you are very audible, very audible. Welcome,
Can you
Dr.
hear
Gayatri.
me?
And, yeah, we can hear you. Yeah, you can hear me.
Yeah, okay.
And Dr. Deori, Dr. A.K. Deori is from AIMS, Delhi.
Yeah.
Is Dr. Deori online?
Namaskar ji.
Namaskar, Dr. Sahab, welcome.
Yeah.
So you are not in your office right now, you are at home.
So I have 3 webinars, one after the other, which are lined up. So I'm at home. So my name is Deorari.
Deorari, okay. Sorry
Yeah,
for
Deorari.
that.
Yeah.
You are from which place, Dr. Deorari?
I belong to Uttaranchal near Badrinath area.
Acha, great. And that's why the forest in the background of your
Yeah.
wall. Yeah.
Yeah.
Okay.
So I am at AIMS for the last 46 years now. 46 years.
Wow, wonderful. Great. So look forward to hearing you.
Sure.
And Dr. Meenakshi Mesham, is that how you pronounce it?
Meenakshi Mehan.
Dr. Meenakshi
Mehan.
Meham,
M-E-H-A-N.
yeah. Meham, yeah. So Dr. Meenakshi, welcome to you too.
Yeah, thank you.
This is
And you are based in Vadodara? You are based in Vadodara? Great. So from the WCD side, who are we having here? I think the WCD team is yet to join.
Sir, they've gone down to bring Dr. Paul.
Okay. So I guess there will be some questions that will be asked, and I think you have been shared with this document, no? The questions which will be asked. All of you have been given a copy of this. Have you got it?
Yes.
Yeah, no? And I think we can be short and brief in our presentation. The larger message is very well known and is clear, but coming from your side with the authority that you command, it will have a great impact. We are sure of that. Who else is joining? Ma'am? Who else is joining other than this group? मैम और कौन कौन ज्वाइन कर रहे हैं इसके अलावा बताइए ओके
I think Dr. Paul.
I'm very delighted to welcome a very distinguished guest today, Dr. Vinod K. Paul, Member Health and Nutrition, Niti Aayog, Dr. A.K. Durari, Professor and Head Pediatrics, All India Institute of Medical Sciences and President of the National Neonatology Forum of India, Dr. Meenakshi Mehen, Professor and Head Department of Food and Nutrition, Maharaja Sayaji Rao, University of Baroda, and Ms. Gayatri Singh, Nutrition Specialist of the UNICEF, New Delhi. We are very delighted to welcome all these distinguished guests on our webinar on sustaining breastfeeding practice during COVID-19 challenges and solutions. This is a very, very critical issue because on the occasion of World Breastfeeding Week, we must remember that every year 4.1 million of young children lose their lives before their first birthday. Evidence suggests that increasing breastfeeding to near universal levels could save more than 8 lakh lives every year. The majority of being children under 6 months. Promotion of breastfeeding is not only a life-saving intervention, but it is also most cost-effective intervention in our fight against infections and associated mortality risk. Every year, $1 invested in promotion of exclusive breastfeeding reaps $35 in return, according to Lancet. Besides benefit for infants, breastfeeding is beneficial for mothers as well. It decreases the risk of mothers developing breast cancer, ovarian cancer, type 2 diabetes, and heart disease. It is estimated that exclusive breastfeeding could avert 20,000 maternal deaths each year due to breast cancer. This year's World Breastfeeding Week 2020 theme is Support Breastfeeding for a Healthier Planet. Breastfeeding is the first food and natural vaccine for a child and thus forms an integral part of a sustainable food system. While breastfeeding is a natural process, it is not always easy. Mothers need support both to get started and to sustain breastfeeding. In India, only 1 out of 4 newborns receive breast milk within 1 hour of birth, which is the golden hour. And this is a shame for all of us. With the current COVID-19 situation, there is greater need to promote and support this behavior. The question is, how do we do this? Our distinguished panelists today will give us insights on this very important topic. But before I introduce them, I request our online viewers to leave their questions or answers in chat box, and these will be addressed by our panelists subsequently. I request Dr. Paul to provide us insights for our viewers on breastfeeding as an important life-saving intervention in current COVID-19 context.
Thank you very much, Amitabhji. Welcome to the webinar. Very warm welcome once again on behalf of the Niti Aayog. We have a very distinguished panel, so the questions and the context will be provided by the panelists. I just want to emphasize the fact that we are in the midst of World Breastfeeding Promotion Week, which is always the first week of August being celebrated to promote breastfeeding, to spread the message of breastfeeding, and to align families, mothers, and all stakeholders, including government, to ensure that the breastfeeding goodness reaches every baby on this planet. And I'd just like to make 4 points to bring forward this notion. Firstly, breastfeeding is natural. We are ultimately one species on this earth. And this species, the human species or Homo sapiens, the natural food that should accrue to the progeny, to the baby, is breastfeeding. It is the law. It is not an exception. It is not something for which there is a choice. It is ordained by nature or the God. And therefore, we must first and foremost understand that there is nothing like us, nothing like an alternative to breastfeeding. That occurs in very few situations that we can touch upon perhaps. But this is the law, and a deviation from this is against the tenets of nature. And the nature has so designed breast milk and breastfeeding interaction that it is great for the body, and we'll hear more about this from our distinguished colleagues. It's great for brain, and therefore mentation, cognition, spirituality, an ultimate contribution of the individual to the society. It is protective. It serves as a vaccine. This is how it is so ordained. And above all, the breastfeeding interaction between the mother and the baby is so critical to the emotional development, to bonding, and to the very heart of human civilization, which is centered around society, centered around family, and so on. So it is the law of nature. That's the first point I want to make it, that it's law of nature with which we would like to align ourselves. The second point is, if you view breastfeeding as a goodness for health and nutrition, what does it do for us? As I said, that it is for the body. So the growth, brain growth, and the very functions of the brain in terms of cognition and development. And as Amitabhji said, that it is something which is innate to survival. It is so important that it is innate to child survival. And let's look at some numbers here. With your permission, Amitabhji, you'll be surprised that mortality rate in babies who are not breastfed is clearly 4 times those babies who are breastfed. So you reduce the risk of dying by 3 times. Okay, that is the difference. Breastfeeding protects 72% of hospital admissions due to diarrhea. 72%. Practically 3 out of 4 diarrhea admissions are averted in breastfed babies. And 57% of the respiratory illness related admissions are protected. So it is something which clearly translates into health, particularly infant health, particularly child health and newborn health. And when we look at where we are with regard to the compliance with this intervention, this law of nature, it compliance with something which is so critical to survival, then we see that because of human ignorance, because of our ignorance and our not being supported by the right messages and right environment, we end up having the following situation, that only about 55 to 58% babies are breastfed in the first 6 months of life, whereas it should be 100%. Universal. Why? Something which is natural, something which is free in some sense, something which is accessible, that 40% babies are denied. We are of course happy that there is some improvement in this regard. And then you talked about the golden hour. More than 40%, close to 50% babies are denied access to breastfeeding in the first hour of life. And the first hour breastfeeding is so critical to establish breastfeeding in the mother and the baby diet. So we fail as a society, we fail as a community to impart this natural gift to the next progeny, which is critical for body, mind, and soul. And when we look at this even more critically for the needs of the low birth weight baby, it becomes even more important, because it is a small baby born early or born too small who has a much higher chance to succumb to illnesses and to lose life. And their breastfeeding and breast milk is even more important, and there we falter even more. The babies who fail on breastfeeding very often are the small babies. And therefore my third point relates to the fact that think about small babies feeding as a very important part of our endeavor. And within that, therefore, there is a need to understand the value of kangaroo mother care, skin to skin contact from the very beginning, and the ability of the mother, helped by the care providers, to be able to express breast milk, because the baby, in case the baby does not latch onto the breast, there is an alternate way of feeding the baby and using the cup and spoon or Pellade and spoon in order to make sure that the breast milk reaches the baby's stomach and the baby gets the value of this great bounty of nature. So we need to carefully think through the fact that the babies who need the very most are the small babies, and when we go about promoting breastfeeding, solving problems related to breastfeeding, we must keep in mind the special focus on the mothers and the babies, on the mothers of the babies who have small babies. But today our focus is very contextual, and this breastfeeding week is in the midst of a pandemic, and there are now new issues related to the COVID and the breastfeeding compliance. And today we will focus in large measure in that direction, but we shall never forget, COVID or no COVID, breastfeeding is best for babies, and we are here to talk about that in more detail in the presence of our audience out there, and to be discussed by a very, very distinguished panel of experts. Over to you, sir.
Thank you. Thank you, Dr. Saab, for your very valuable insights. We greatly appreciate them. May I now request Dr. Meenakshi Mehan to kindly give her recommendations for promoting and sustaining breastfeeding during COVID-19, please. Can you kindly unmute? May I request you to kindly unmute and speak?
I'm trying it. But I'm not able to
Yeah,
do that.
please go ahead.
Can you hear me? Can you hear me?
Please go ahead.
Yeah. Thank you very much for having me here, Dr. Khan and Dr. Paul. Now, without taking much time, I would just, Dr. Paul has already pointed out, COVID or no COVID, fortunately, the data that shows is that there is no vertical transmission and there is very less chances of, breastfeeding to be altered in case the mother is. So therefore, it becomes very, very critical that breastfeeding continues in normal conditions and more so also in COVID conditions. Only caution that we have to take is that if the mother is having COVID positive, she's called COVID positive, then she has to be wearing her mask, washing her hands, and if she has any kind of cough or anything of that kind, she should be coughing it out in a tissue, wash her hands with disinfectant, soap, and if she has coughed or even on her breast, she could wash her breast, but need not do it every time. If she has cough on her breast, then of course she can do the cleaning and disinfection. So, very, very important, as Dr. Paul had already pointed out, breastfeeding is very, very critical, and it becomes more critical in children who are born during these conditions because the breast milk, especially the first hour and the golden hour, gives you those antibodies, IgA, which is very, very necessary for keeping our immunity strong and for the child to be able to fight infections. So, basically, no change in breastfeeding practices, initiation within 1 hour of birth, even when the child is having a cesarean delivery, and then moving in kangaroo mother care, skin to skin interaction, so that the breastfeeding initiates, is the same as we have for non-COVID conditions. Only caution that we have to be again, I will repeat is that we have to be little careful about if the mother has positive COVID, then she should be wearing the medical mask and taking care of the baby by washing her hands before breastfeeding, washing her hands after breastfeeding. Thank you so much.
Thank you. May I now request Dr. A.K. Diorari to tell our audience about key challenges that emerged due to COVID-19 in promotion of breastfeeding, especially for low birth weight and preterm babies, and how have the health systems adapted to ensure that newborn get best care and nutritious food.
Thank you, sir, both the sirs, for giving me the opportunity to share how at this time of pandemic we can still provide best practices, best care for our preterm babies and sick newborn babies who are born to COVID suspect or COVID positive mothers. These babies have to be treated just like normal babies who are born to normal mothers. And if required, what we need to do is in the initial period, because the mother is COVID positive, we need to keep these babies in an isolation room, not mix them with the normal babies till we are able to do a test on the baby on day 5 to show that the baby is negative. And if we have baby is well and able to take mother's milk, the baby can stay with the mother with the precautions with Dr. Minakshi alluded to, wearing a mask, making sure doing hand hygiene before touching the baby, before doing any procedure on the baby, and making a distance between mother and the newborn baby. But if baby is preterm and small, majority of the babies who are above 1800 grams, they can be still cared as you are caring for a normal baby. Few of these babies may not be able to take breast milk directly. In that situation, what we have to do is we have to encourage the mother to express either with the hands by taking adequate precautions for hygiene so that there is no contamination of express breast milk, which should happen, or she can use a pump for expressing the milk. In places where there is facility of availability of donor mother's milk, if the baby is very sick, admitted in the NICU and is on the gadgets, or the mother is sick and the baby and mother has to be separated from each other, in that type of situation, what we can do is we can use donor's mother's milk. But that type of facility may not be available at majority of the places. The best cost-effective way would be to express the milk under hygienic conditions and give that to the baby. And then if the baby has some comorbidity, that has to be managed just like we manage any premature related morbidity in that premature baby. So that is in addition to giving mother's milk to the baby. And once the baby is on sick, he is too small, premature baby, that baby one has to give through the tube feeding and then gradually wean on to spoon feeding and pellet feeding till the baby is mature enough to take direct breastfeeding at 34 weeks of gestational age. So there is a transition from tube feeding to pellet or spoon feeding and then to breastfeeding direct at 34 weeks of gestational age, because we know mother's milk is the best milk in a premature baby. It is going to prevent infection. It is going to make that baby survive more, thrive better, and the risk of malnutrition or undernutrition at later age is going to be less. And if we are able to promote that the mother is expressing the milk, chances are that baby will go home once the baby is well on breastfeeds back home. For a smaller baby, above 1800 grams to 2.5 kg, if baby is stable, even kangaroo mother care, as Dr. Vinod Paul was saying, can be practiced along with the mother by taking adequate precautions so that horizontal transmission of COVID is prevented in that baby.
Thank you, Dr. Saab. Thank you so much. May I now turn to Mrs. Gayatri Singh to share some insights from the community highlighting solution for ensuring messaging and practice of exclusive breastfeeding. Dr. Gayatri Singh.
Thank you very much, sir. It's a pleasure to be part of this webinar. Importance of breastfeeding, but despite that, infants are not breastfeeding in time. They are not exclusively breastfed, and breastfeeding is not continued to 2 years and beyond, along with complementary feeding on completion of 6 months. Breastfeeding has advantages every time, everywhere, including during the COVID times. It's especially important during the COVID time. If breastfeeding offers so much of benefit, then we should understand why families do not exclusively breastfeed. And here I would like to highlight a few reasons. One is mothers and families believe that children need water with breast milk, especially during the summer months. And this is one of the reasons why water and fluids are given to the babies. The second deterrent that influences optimal breastfeeding is mother's concern that she does not have enough breast milk. And as a result, there is introduction of other foods and drink. The third concern is ill. So in some instances, families withhold breastfeeding, whereas the fact is that during this period, children need more breastfeeding and frequent breastfeeding. Similarly, mother's illness can also impact on the breastfeeding practices, and this is very relevant in the context of COVID. But previous speakers have highlighted that it's absolutely safe to breastfeed, even irrespective of the COVID status of the mother. All you need to do is practice adequate hygiene practices. We cannot discount the role that commercial, especially infant formula and baby food, can have on undermining breastfeeding. The reason why I'm highlighting these barriers is it's important for us to understand these barriers so that we can tailor the messages accordingly, as has been done during the Poshan Abhiyan. We've talked about barriers, but I think what is also important to look at what works. And we have evidence from the field that it is possible to improve breastfeeding at scale. And for that, what is needed, I would highlight 3 things, in addition to, of course, an enabling environment where you have programs, budgets, and policies. One is good quality, consistent messaging, so that the mothers get consistent messaging, there is no confusion. Second is reinforcement of messages through multiple contacts, multiple channels, because we know when these messages get repeated, attention. Last is, of course, the skilled counseling support and for breastfeeding. And here I would like to point out that this counseling support needs to be provided to the families, pregnant women and breastfeeding mothers. And here I would like to highlight on pregnancy, because evidence tells us that intention to breastfeed is formulated in the 3rd trimester of pregnancy. So antenatal period is important for pushing your messages on breastfeeding. It has to be provided at the facility level, in the community setting, and in the home settings. Also across the entire breastfeeding continuum. And here I mean is from the time of initiation to establishing exclusive breastfeeding to maintaining exclusive breastfeeding. These 3 periods are distinct but interdependent. We know early initiation helps in establishing breastfeeding, and if exclusive breastfeeding is established, there are more chances that it will be maintained. Having said this, it's important to understand that the quality of counseling is important, because if the quality of the counseling is suboptimal, it will not have the desired impact. To highlight some of the aspects of quality, one is messaging is important. Again, complete and consistent messages, not only directions of what needs to be done. Second, you have to build the trust and the confidence of the mother. You have to assure that, yes, she can breastfeed successfully. So counseling needs to boost that confidence in the mother. The third is to offer practical, doable things to the mothers. Like we know it could be how you hold the baby, how do you position the baby to the breast, which will help in mothers overcoming the feeding difficulty. In summary, I would say like there is huge opportunity in India. We have the programs, the potential is there. What is needed is to deliver these interventions to achieve coverage, continuity, especially in the context of COVID, intensity.
There is a question from Meenakshi for Madam Dr. Meenakshi Mehan, and the question is, how many times in a day should a newborn be fed ideally?
Yeah, actually it should be as and when the child asks for it, it should be ad libitum. But average it comes out to anywhere between 8 to 12 times, 8 to 10 times a day.
Okay, there's a...
It should never ration or plan the feed of the child. It should be given as per the demand of the child.
Okay, thank you. There's another question for you, Doctor. And this is from Mr. Vivek, who says that we know that stress is the #1 killer of breast milk supply, especially in the first few weeks after delivery. How do we minimize the stress in COVID-19 positive mothers, please?
Sorry, I didn't understand very well, but I think in COVID positive mothers, most importantly is to give psychosocial support to the mother and try to keep the moving in as far as it is possible, unless the child is having some kind of issue or the mother is having issues. Moving together is very important, and hygiene behaviors have to be kept in mind, and that's all I think should be done.
There's a question from Dr. Rajesh Gopal for Dr. Diorari, and he asks, interventions like kangaroo mother care and breastfeeding by a lady infected with SARS-CoV-2 would perhaps need barriers like N95 respirator masks in many circumstances. What if the feasibility for this among rural population is extremely low? How do we handle this?
See, yeah, so we know that if a mother who is COVID positive, she has to breastfeed the baby, she has to wear a mask. There is no doubt. The best is if she can have an N95 mask, because it will retain more virus inside the mother rather than giving it to the baby. But if that is not available, even a triple layer mask can be used. And one has to make sure while the baby is breastfeeding, all hygienic precautions for hand hygiene also has to be taken. While the mother is putting the baby on the breast and after the breastfeeding, that has to be taken care of. While she is doing kangaroo mother care, again, she has to wear mask. She can keep her head on the other side, and it can be continued. And always many times you will need a support from any other family member who may be a COVID positive young adult, maybe another female member from the family who is there who can support her, and then take the baby on the chest and then try to help her in doing kangaroo mother care. So kangaroo mother care for low birth weight babies can be practiced if the mother takes all precautions for prevention of aerosol dissemination of COVID, SARS-2 virus, and then takes precaution for hand hygiene. And if there is a support by some family member who is healthy. If that is not present, even few of the nurse champion, what we need nurse leaders, nurse champions who can support those type of mothers in helping her to do kangaroo mother care. Even for counseling, for attachment, for positioning of the baby, you need support. You need to see how it is being done by the mother. And that part can be done by a nurse leader who is working in that healthcare facility. So there is a huge amount of importance of local leadership which has to get involved into it. And many of the champions who will be there in the unit will be support in addition to the family member who may also chip in for that. But we have to make sure there has to be isolation room if the mother is COVID positive and the baby is kept in that room along with the mother. We have to have a separate place for that. That we have to ensure. It can be a room or it can be a ward also for COVID positive mothers with the babies. As we have seen in many units in Mumbai, there are big wards which are there where COVID positive mothers are kept, even with low birth weight babies, and mothers are doing kangaroo mother care because there are some counselors who are there who support those mothers for doing kangaroo mother care. So I think it is possible. It is happening in the country at many of the centers, and this is very much possible. It happens in my hospital also.
Dr. Saab, there's another question for you. And
yes, sir.
This is from Mr. Ramanathan, and he asks, is it absolutely necessary to do a swab for neonates born to a COVID positive mother? Can a COVID positive asymptomatic newborn transmit infection to others?
See, as a policy, if mother is COVID positive and baby is born, normally if baby and mother are kept together, on day 5, we always do a test on the baby to see whether the baby is COVID positive or not. What we have seen in the long series in the country, which have been collated under the organization National Neonatal Forum of India, we had nearly 841 COVID positive mothers and their babies in which the data was collected. The positivity rate in them is only 6 to 7%. And most of those babies are asymptomatic, and the babies don't have any symptoms. They breastfeed with the mother, and there is no need for doing any test on the baby for repeat time, because we know after 8-9 days, even if the baby has a horizontal transmission, after 8-9 days, by the time the mother goes home, the baby is going to be like negative on its own, because the virus replication is going to disappear there. But in the initial period, if the baby is only 3 days and baby is also COVID positive and he is going to go home, we have to make sure that that baby also can transmit infection to the family members. That part has to be kept in mind. I hope, Ramanathan, I answered your question. Sir, the best part is, I think we are very lucky. Babies, most of the time, even if the baby is COVID positive, he's asymptomatic. 98% of the babies are asymptomatic. 2 or 3% of the babies who are symptomatic, they are symptomatic not due to COVID, but due to the other comorbidities which are there, like birth asphyxia may be there in the baby, or the baby is premature, he is having respiratory distress, or the baby has got infection or a congenital malformation and he is COVID positive. So I think we are very lucky. Newborn babies are pretty safe from getting severe COVID infection, and there is a science behind it, because in newborn babies, immune system is not developed much, so they don't tend to have moderate to severe disease. The receptors on which the COVID virus sits on, their numbers also is very less in that newborn baby. So due to the immature immune system and the receptors on which the virus will attach is very less in number, babies are very safe, I would say, from developing any severe COVID infection. I think we need to change the mindset of the healthcare professionals on this. A lot of healthcare professionals think that if we give mother's milk, the baby is going to get infected. No, it does not come in mother's milk. It has been shown, evidence is there, science is there. It does not flow in the mother's milk. On the other hand, if a mother has got COVID infection, maybe after 8-10 days, there will be IgA antibodies and IgG antibodies which will protect that baby. Maybe those antibodies will last for some time, but it is protective to that baby. And all the benefits of breast milk, the baby is going to get. So I think we need to promote breastfeeding. We need to take precautions that as a healthcare professional, we ourselves don't get exposed to COVID infection. And for this, sir, I would say I have a simple mnemonic which everyone has to remember, and it is said it is by the term SMS. Number one, S is we need to have social distancing. M is we must wear mask all the time. Another S is sanitization of hand. That means hand hygiene has to be done. And another S is self-screening. If any healthcare professional himself or herself or any of the attendants has got fever, cough, they should isolate themselves, get them tested. So the mnemonic I say is SMSS should be remembered by all healthcare professionals to make sure that they don't get infected themselves, sir.
Thank you, Dr. Diorari, for so beautifully explaining it. You did a great job of presenting the whole picture in such a wonderful perspective. Thank you so much. There are two questions for Dr. Gayatri. One is from Bijay, and she asks how you think Mothers Absolute Protection Program, MAA, Mothers Absolute Protection Program by Ministry of Health and Family Welfare is being implemented for promotion of breastfeeding, and what are the changes? There's another question for you. How can we improve counseling for early initiation of breastfeeding and promoting exclusive breastfeeding? So may I request you to kindly respond to
Thank you for these two questions. The mother's absolute affection. It has one component is on building the skill of the facility level health staff, especially the nurses. It also reaches out to the ANMs at the community level and ASHAs to provide information and counseling to the caregivers. What Ma has done is standardize the training package. So the standard training package is available for counseling. States have used that counseling package for training of the facility level as well as the community level, especially the ANMs. There has been a sensitization meeting. In addition to this, MA also has provisions for standardizing the facilities to become baby friendly. So award and assessment is also an integral component of the MA program. MA program, though, has not been evaluated. If we look at the data which is coming up, we are seeing an increasing trend in early initiation of breastfeeding. We are also seeing some improvements in exclusive breastfeeding. But having said this, it would be difficult to say whether this is because of MARC program, because simultaneously a lot of other efforts have happened, namely Poshan Abhiyan, where breastfeeding and complementary feeding is a priority. So what is important is that families need support at the facility level, at the community level, and through home visits to support and promote breastfeeding. The other question on counseling here I would like to mention is we do have training. We are focusing a lot on using a standard training package. We are focusing on training our frontline functionaries. But what is lacking is how do we provide on-the-job supportive supervision to the frontline functionaries? Because one training, no matter the duration, no matter the quality, is not going to solve the problem. What is needed is to provide hands-on support to the frontline functionaries to understand what challenges that they face, how they can be supported, what are the gaps in their knowledge, what are the gaps in their skill. So that is an important aspect, and that's where the supervisory cadre can play an important role. In addition to this is we've had experience in some of the states, especially UP, where we have partnered with medical colleges, and they have supported the system in putting a supportive supervision mechanism or quality control mechanism to continuously build the capacity of the frontline functionaries. This is a COVID situation. What is not happening is, but existing platforms of sector meeting or block level meetings need to be used to address the and challenges that the frontline functionaries face, address their knowledge gaps, and continuously support them. So, if we include these two things, we will be able to improve the quality of counseling that is provided either at the facility level or and at the outreach sessions like VHSND or during the home visits. Thank you.
I will now turn to another question to Dr. Meenakshi Mehan. How can academia be engaged? There's a question, how can academia be engaged for breastfeeding promotion in these very difficult and very challenging times? And can you guide us on this?
Actually, academia can be working on pillars, 4 to 5 pillars that for any kind of a situation, not promoting nutrition, health, or other things. One is system strengthening. As Gayatri was saying that, MA program and other programs that have been rolled out by the government. We in academia, as part of our student trainings and student placements, can put our students along with these institutions to help and fill in the gaps and try to help and support in breastfeeding or any other issues that we are talking about. One very important part is which academia can do. Then another very important issue is capacity building, as so many trainings that are done, and it requires quality of training. Also, the trainings have to be of good quality that academia can pitch in. Then another thing which we have ourselves done is we believe in having lots of partnerships and alliances. And in fact, in 2017, we made a breastfeeding alliance of Vadodara with IAP, Foxy, Medical College, our department, and our own municipal corporation. And we try to pledge and friendly hospital initiative and try to see that at least in Vadodara we have most of the hospitals which are baby friendly, and the next year we found that about 16 baby hospitals had already pledged for that. So that means working with partners, having alliances, and lastly, of course, the advocacy to government, with community, whatever is required can be done with the help of academy. Thank you.
Thank you. I would now request Dr. Paul to give us his perspective on how to make this a Jan Andolan, how to make this a mass movement and take this to the common people and to the rural areas of India, spread, extension and mass communication. Dr. Paul, can you guide us?
So, we heard what should be done, the key words that I heard, and we'll continue to repeat them. As Dr. Derari said, the babies are safe. So one big message is that COVID-19 pandemic is quite safe for the babies. And yes, the mothers can have morbidity. Of course, adults also very often are asymptomatic. But yes, agreed that they can have a comorbidity in addition to pregnancy by itself, that is a stress, agreed. But the fact remains that God is kind to babies and babies are safe because they will not react in a bad manner. Even if they acquire COVID infection, they will hardly ever be symptomatic. And the second message that I'm hearing from all of you is that breastfeeding is great for COVID era also for babies. There is no change. There is no change whatsoever. And only precautions are the same precautions that not only the mothers have to take, social distancing and mask and hand hygiene, they have to be taken by everybody. Whether we are in the hospital, whether we are in the metro, or we are sitting in the office here, or in any other place in the market. So there is actually, we must demystify this area completely to say that babies should be welcomed, they have practically no risk. They must be given the goodness of breastfeeding, and the principles that I heard are entirely the same principles as would apply to newborn babies in normal times. But Ashok, I have a question to you. One is, how do we educate the providers? And I'm not looking at sophisticated neonatologists. I'm looking at, our nurses, our doctors, the workforce in the places where the deliveries are taking place in the country, private and the public both. So how do we go about doing it? I believe you developed guidelines, but then how can we disseminate them? Do you get it? Are you getting involvement of the state governments and other stakeholders, the UN organizations, or how do we convert this into a Jan Andolan in the provider space first? Over to you, Ashok.
So I think what we know there is referring to is how quickly we can disseminate to masses the right practices for personal protection from COVID infections, especially for mother and newborn babies. And how do we connect to people who are at remote places in the country? So I think we have a choice in this digital era that we can harness digital technology, especially e-learning, to reach foreign places. And we can have mentors also in e-learning so that group of cohorts of students can be mentored for the right practices. And if they have any challenges, those challenges can be addressed. We can have app on mobile phone which can reach to people, which can teach what the best practices are. And then this can be blended with virtual sessions, just like we are doing at this point of time with the help of WebEx platform, so that you can connect to thousands of people and healthcare providers who can ask you what the commonly asked, frequently asked questions they are facing at their health facility. But Vinod, I would stress here, sir, and even to senior people who work in Niti Aayog, there is a huge, big role of leadership which will fill no to do gap. That means we know every is that we are not able to initiate breastfeeding. We have 80% of babies getting born in the hospitals, but initiation of breastfeeding within 1 hour is exclusive breastfeeding is only 57% in the country. So we need that we have local leaders at the state level. We need leaders at the facility level, because the leaders are required in facility level because they will be able to motivate people. They will be able to appreciate people who are doing good work. And if there is any day-to-day problem, they will be able to fix it. So we need leaders at the state level, we need at the facility level, and then we need in the community also leaders who also promote breastfeeding and normal essential newborn care. Why to forget immunization services which have to be followed for these babies once they get discharged? We should not miss all those opportunities. And engaging family in a big way in the form of a Jan Andolan can be done if we have local leaders in the state and the states take the ownership that they will engage all the people who are working in the healthcare facility and take the message forward that breastfeeding has to be started early, exclusive breastfeeding has to be done, because there are multiple reasons you already enumerated. It saves babies, it prevents infection, prevents morbidity in the baby. So what is needed is, sir, situational leadership at the COVID time, in which the top leader will take all the leaders together. And I would say each warrior who is working like a champion who is trying to support the family while the mother is COVID positive. So we need to engage all these people together. And the best way is using e-learning and virtual learning, Vinod.
Thank you so much. So Gayatri, tell me, what is it that we can, now that we understand the ramifications which are practically nil, in the context of COVID disease for the newborn babies, and we just demystify and break this myth that any special, no's exist in this area. What would be your, your thinking around how to engage the stakeholders, and particularly UNICEF? You have presence all across the country. Are you making any special effort that people should know about? Are we working on a helplines, for example? Can you give us some ideas which the listeners and the people who are watching this webinar may like to be engaged and spreading the good word? Any ideas on making, into a real movement that we are talking about?
Yes, sir. Here, I would like to highlight one thing, because COVID was a new infection. The knowledge was evolving. So what was important between UN agencies and the development partners, so that you are on the same page when it came to messaging. So not waiting for complete knowledge, but starting with whatever information and guidance was available. And there we used information which was coming from WHO. This guidance was quickly translated into information flyers for the state level, and the challenge was how do we reach it to these state level functionaries. So what worked was like the states use virtual platforms to orient their functionaries up to the district and the block level, and in turn some of the states practicing social distancing did also attempt to train the frontline functionaries. So this message was spread to the frontline functionaries. More needs to be done, because ultimately it's they who would be carrying these messages to the caregivers. Here, sir, I would like to mention that something very innovative that the frontline functionaries did, because things had not changed. So they knew what information they have to communicate to families. So that they knew from our program, that they knew from Jan Andolan. So they had the messages, they had the videos. So what the frontline functionaries did was, and then some of the frontline functionaries also had smartphone with provisions for WhatsApp. So they created groups for the mothers for different categories. They would create groups for pregnant women, they would create groups for breastfeeding mothers, and disseminate messages, including use of videos. And some of the frontline functionaries use their own creativity and made videos on their own. In addition to this, the home visits where they were doing contact tracing and surveillance, also the key messages on nutrition, including breastfeeding, was integrated. So a lot of digital platforms, telephones, and in some states, there have been GramSats to provide information. So these have been used, but what is important is to understand what has been their impact, how they have been perceived, and whether the families are assured that it is safe to breastfeed, even irrespective of the efforts that are happening.
Thank you. So we need to accelerate all these efforts. In normal times also we would have been doing this, but there are issues, but this is an opportunity, a win-win opportunity. Meenakshi ji, your final reflections, what would be your message? You have 2 minutes to give your final and very forceful message that you like our viewers to know. Meenakshi.
Thank you. My final message will be that as in normal conditions, COVID conditions, whatever, breastfeeding is a must. It is a boon to mankind, and therefore it has to be promoted. And one issue that I would like to point out here is that, as has been mentioned earlier also, that institutional births are increasing, but our initiation in 1 hour is about 50% of the institutional births. So I think the facilities, the hospitals, the doctors, they also have to emphasize, inform the nurses that this is very, very important and it needs to be initiated. Because once the initiation happens, breastfeeding is establishment becomes easy, and then the mother can go happily, and the counseling about around 4 months counseling again should be given, because as Gayatri also pointed out that mothers have this concern that their milk is not enough, so they need to be counseled and counseled and counseled. So continuous counseling is very, very critical and supportive support for in the platform
Yeah.
for mothers especially.
Very precisely enunciated. Thank you so much. Over to you, Amitabh ji.
So thank you so much, all the distinguished guests. We've had some very remarkable insights, and I think our audience would have greatly benefited from your wisdom and from your deep knowledge regarding this area. And I would like to personally thank Dr. Vinod Paul, Dr. A.K. Durari, and Dr. Minakshi Mehan and Ms. Gayatri Singh for this very, very knowledgeable session. We have greatly benefited from your insights, and I think our audience would have learned a lot enormously and would help us make this challenge of sustaining breastfeeding practice during COVID-19 a mass movement in India. Your participation in this webinar is greatly appreciated. Thank you very much, ladies and gentlemen.
Thank you so much. Thank you.
Thank you. इसको viral करा.